Hello, good evening, and how are you? How are you day? Happy Easter. Welcome to the last day of the month of March 2024. How are you? This is Ask the Doctors, a health program that holds every Sunday by 8 p.m. Nigerian time. Now, this program has been on for about 4 years. We meet here every Sundays. My name is Frederick Unubohai, and I'm privileged to be your host. My co-host is Dr. Israel, and Dr. Israel will be joining us soon on the program. Now, for tonight, we'll be having a question and answer session. So, today we are having a question and answer session. Any question you have, please ask us tonight on the program. But before we move ahead, I want you to tell me, where are you watching me from? We are live on Facebook and we are live on YouTube. If you can hear me, just tell me I can hear you. Happy Easter. Where are you watching me from? Oh yeah, let's go. Let's go. Oh yeah, let's go. Put it in the comment section. Everybody, tell me, where are you watching me from? And share the video, share the live session. Guys, share. Click on the share button. If you are watching this video after we have ended, I'm sorry, we might not be able to respond to you because I noticed that after we end the live session, some people come online and they're like, Doctor, have fun and answer me. Sorry, no vex. So, in case you're watching us after we have ended, we will not be able to respond to you. But if you can hear me now, let's go. Yeah, I see some people already in the house. Let me give a shout out to who's here. We have Chiwendo. Chiwendo is watching me from Wari. Mutiu Olamide, I can hear you. Okay. Michael from Abuja, Nigeria. Aderonke from Osun State. Dumebi says I can hear you from Abuja. Oh yeah, now Mutiu is watching me from where? From Ibadan. John from Dubai. Oshe. I'm watching from where? From Kogi State. Oh yeah, ladies and gentlemen, please share the video. And then if you have questions, happy Easter. Ben Juliet, how far now? So if you have a question for me, start dropping your questions tonight. But remember, we will not be able to treat you on social media. We will not be able to prescribe medications for you on the internet. You have to go to the hospital and see your doctor. But if there's anything that is not clear to you, oh man, use pigeon. If you get anything we no clear, or yeah, ask me tonight. Ask me. Let's go. If you are watching me on YouTube, for those watching me on YouTube, drop a comment. Let me give you a shout out. Watching you from Bahamas, from Dubai. Mm, from Bahamas, I see you. Oh yeah, from where? From Abuja. Okay, Japheth. Happiness. Happiness from Benue. Oh yeah, let's go. So, ladies and gentlemen, drop your questions and let us start. Let me see if I can go live as well on TikTok. Let me see if I can go live on TikTok until Dr. Israel joins us. Queen, Queen, I see you. Queen, how far now? Queen, how are you? Yeah, Queen Juicy. I see you. Oh, okay, that was your name, Juliet. Okay. Somebody says, I'm having sharp pains in my chest. What could be the cause? Mutiu Olamide. Now, this your complaint is non-specific. Sharp pains in your chest. Remember, you have your lungs in your chest. You have your heart in your chest. You have your ribs. You have your muscle. So if you are having sharp pains in your chest, it tells me nothing. Because if you have pains, sharp pains in your chest, there's no way I can know the cause. But you can provide more details. We can advise you. However, we would not be able to make the diagnosis for you on social media. Is that okay? So if anybody want to ask a question, do me a favor, provide enough information. Okay, Angela from Benin City, I see you. Faloshe, causes of what? Bloating. Bloating or bloating? Bloating. Is it bloating? Is that what you are saying? Good evening. I'm live on TikTok. I am also live on Facebook. I'm live on YouTube. Charity from Lagos, I see you. Okay, Juliet, I see you. Okay, there's a question here. I want you to follow me. Cough is really disturbing me over 2 months now. I have taken so many drugs for that, yet no solution. Peter, my question to you is 2 months cough. The medications you are taking, who they give you the medication? Who they prescribe am for you? Wetin you dey treat? Because it's not enough to tell me say I dey cough, I don take cough medicine for 2 months, e no go, I don drink medicine. Guy man, na who give you medicine? Wetin you dey drink the medicine for? Shey you get good. So provide those information, and then everybody share. We have a lot of people here tonight, so share. And if you're asking me your question, provide enough information so that I can advise you, but I no go treat you or abeg. Here no be hospital. Okay, what can a lady do or take to prepare for pregnancy and give birth to baby boy? Michael, you dey ask me 2 questions, so I'll answer you fast because we get many questions here. Number one, as a woman, if you want prepare for pregnancy, wetin make you do? Start to dey take your folic acid. Number one. Number two, know your ovulation. Very important. Number three, avoid all those harmful substances like alcohol, smoking. Avoid them. Avoid all those caffeine. You understand? Eat healthy food. Eat nuts, granules, and normal fruits. It will help your body. Your ovulation dey important because if you no know your ovulation, you can't go meet your partner outside of your ovulation, belle no go enter. So you must know your fertile period. If you no know am, go my page, the video dey there, or go YouTube, the video dey my YouTube. How to calculate your ovulation, how to know the signs of ovulation. Now, your second question talk say how to give birth to a baby boy. I'm answering you because people don't ask this entire. And you get one or two things where you fit do, but it get a lot of explanation. So, Mr. Michael, go to my YouTube, look for the video, how to give birth to a baby boy or baby girl. You get plenty explanation. Finally, now, you might try everything, it might not still work, or it's not 100%. But when you go to YouTube, you go see the video there, how to give birth to baby boy or baby girl. You go watch them. It be like 15 minutes video. So I no fit talk all those things here. Because I get plenty question here. Okay. Una question plenty tonight. Oh. I'm watching from Port Harcourt. My okay, question. My palm shrinks whenever I place my hands in water. My doctor says it's prune and I shouldn't worry. He did not prescribe any medication. God's man. Okay. I won't believe say this thing no they do you before. I mean, I'll say they do you since, and your doctor has seen you. He no prescribe any medication for you because now water they cause some when you put your hand inside water. So the best advice for you now, avoid water for this period. Maybe later your body will adjust. You get some people when they wash with soap, you get how their hands go do them because their hands and the soap they react. Maybe now new water you they use. So your doctor has seen you and said you shouldn't panic about it. Basically, that water you don't need a specific medicine. Only when you can't talk, say maybe they scratch you, they pain you, they swell up. You understand? You have a swelling around your palm. If you can't look, but when you take your hand from the water, you should be fine. Yeah. Good evening, people watching me on TikTok. How are you? Okay. Make una share the live. Let's go share the live. Ahiabo Omolade Pat, I see you. Ayo, bonsoir. Catherine, happy Easter. Can you please explain more about latent tuberculosis? Bosse, please go to our page. Go to my page. Last Sunday, we spoke about tuberculosis. Latent TB simply means say it dey your body don't keep am quiet. Your immune system don't keep am quiet, but the TB is inside you. The moment your immune system goes down, the TB go reactivate, it go reawaken, it go become alive. I'm just answering you, but if you want to know more, go to my page. You go see the video. Last week we spoke about tuberculosis. That is basically what latent TB means. Ngozi Amina, I see you. Happy Easter, everybody. Welcome. Una, not the share. Share the live. And don't forget, if you are watching me on Facebook and YouTube, you can send stars, you can send super chats, super stickers. You understand? This ministry have to move to the what? To the permanent, complete permanent sites. Okay, happy Easter. There is a question I have on my screen. What are the complications of soapy? I'm not going to mention the word, but me and you know what it means. Soapy. When somebody they do soapy, what are the complications? The complications plenty. It will affect you mentally. It will affect you, or what they call psychologically. It will affect your relationship. You go deal with your wife. Your wife no go dey hungry you because your hand can do the job for you. You no go see any value in the opposites. You understand? Basically, nothing be that. So it go affect you. You go dey dependent on soapy. Now, I'm not here to preach to anybody and tell you it's bad. You will. I'm going to tell you it is not healthy. That is the word. It is not healthy because soon you will come there and grow. So you say if you know do your body go dey shake. Okay. I have a question on TikTok. So let me take the question on TikTok. I have followers almost everywhere. Somebody says, please, I've been having headache, but my pressure is 96 and I'm 32 weeks. So you are not getting your blood pressure well. Your blood pressure cannot be 96 and you are pregnant. So if you are pregnant, you are 32 weeks pregnant and you are having headache, constant headache, they should manage you at the hospital, your antenatal clinic. They should check you, check your blood pressure, or maybe you are stressed, you are not sleeping well, but they will check your blood pressure, check your protein and the rest in your urine to be sure that there is no problem. Okay, we have a question on Facebook. Can rheumatoid arthritis be treated? The answer is yes. Rheumatoid arthritis can be managed. They feel manager. So you have to see a rheumatologist. Someone at age 45 is suffering from this. Sure, you can manage it. In case you are just seeing me for the first time on this live session, I beg you. I know they prescribe medicine on social media. I know they treat anybody on the internet. You have to see your doctor, or you go book for a private online consultation. You go pay, because here I'm not going to put my license at stake. Now only teach, I go teach you, advise you. But if now medicine you dey find, is that okay? Okay. Let's see. Let's see. Okay, so they don't block my live session for TikTok. TikTok don't ban my live session. I don't know. So they have ended my live session. Now let's continue. Okay, we have a question here. It says, what could have caused pain in my right hand elbow joint? Getting stiff in the morning when I wake up, but getting relaxed when undergone activities during the day. I have tried to massage it, but it gets a bit relief and return again. Oluwaseun Johnson. So if you dey get stiffness for your joints, I don't know how old you be. I don't know what you dey do. Maybe now walk. Maybe your joints, they get little changes for your joints, which we they call degenerative changes. So one of the change is say your joint fit on the day stiff. When you use them more, you can't day free. So if that thing they happen to you, first of all, they might do a test for you to see that joint how it be. Number two, you might need to do constant massage to be sure. Number three, if you get any work where they do, where they make you use your joints too much, maybe now that work 9 cause this stiffness of the joint for you. Okay. We have a question on Facebook. Amarachi says, I have been on hypertensive medications, okay, for years now. And anytime I stop for 2 or 3 days, the BP goes again. Madam, who tell you to stop your medication? Amarachi Amara, I might not be able to come back to you. We have many questions here. But now who they tell you make you stop am? Now your doctor, I mean now you. Because your doctor, if he tell you make you stop am or make you they give break, he go advise you. So my advice to you is before you stop your medication, you have to have a discussion with your doctor. So he go check, he go tell you say this and this and this. Remember, high blood pressure no get cure. Some people go tell you say they get medicine where you go drink, they go cure your high blood pressure. Now lie yo, they go deceive you. But if you do some kind things to help you, your blood pressure will be regulated. You can watch the video on my page or you can go to my YouTube, watch the video. Some other things there where you feel do to support your medication. But I beg, no stop your medicine for high blood pressure without speaking with your own doctor. Now, before I continue, if you want to subscribe and join my private Telegram, you can do that. The link there my page. I'm saying this for some people. I get people where they there. When you join my private Telegram, you can drop comments there. I can respond to you. I can go live there. I will give you opportunity to speak, ask questions. I will respond to you. The benefit for that place, he plenty past this live session here. So if you want to join, look for the link for my page, subscribe, and join. Okay. Esther Oluwatoba, how are you? Okay, I have a question here. It says, during my ovulation period, I do feel severe pain, and that is normally the time for my ovulation, but I don't see the white slippery mucus. Is it a normal thing? Please, what will I do? Jane, maybe you be new follower. I don't do video about this thing last week. No be everybody go see slippery discharge. They don't use and give women problem. So every woman they find discharge. No be everybody go see discharge. And yet you are ovulating. Your own will be the pain. And I see women go to cry. I don't get egg white. I don't get egg white. I don't get egg white. Problem. No. Not be everybody go see egg white. Huh? Is that okay? Yeah. Oh yeah. I want to see that you guys are sharing this live session. I want to be sure that you people are supporting this live stream. Share the live stream. Invite your friends. If you are watching me on YouTube, let me know. Share, beg. Let's see. Friends. Okay. I'm watching from United Arab Emirates. Doc, it's 2 days now after I finished birthday, but this scratch me. Stanley, go to my YouTube. There's a video there. There is a video there. I beg, go watch am. I do video on this thing. Each and after taking your baths, I add some kind few tips which will help you. The water where you they use, sponge. You can avoid using sponge. You can use warm water. You can dry yourself quickly and some other stuffs to help you before medication. It dey disturb a lot of people though. And that video, people ask me, so I do am. It dey my YouTube channel. So hurriedly, run watch am, I beg. How long will I stay after ovarian surgery before having intercourse? What causes hair around woman breast nipple? Jacinta, you dey ask me 2 questions. I don't know the surgery wey dem do for you, madam. Ovarian surgery, which surgery be that? Wetin dem do for you? So the advice from me to you, you understand, I don't know a lot about your condition, so I no go put my mouth dey talk anyhow when I'm not sure. But the advice for you be say, number one, if your wound don't heal very well. Number two, if you know they get pain, you can start to the knack. You can start. But if they gave you any other advice after the surgery, follow the advice. But I don't know surgery then do. I don't know what they do for your body. So it's gonna be hard to tell you this and this and this. But my advice online would be, if you know, say the site, operation site, it don't heal, you know they pain you, then you can start firing down. Then it is abnormal to be having hair like that around nipple. So this question not too clear. Not too clear. most times we go need more information to know when it starts, which you they do, which cause your problem like that. More information. Do you have any other symptoms? To know why they get hair. Sometimes it might be due to hormonal stuff. Okay, ladies and gentlemen, please power tap, share the live, share the live. Una know they share for me. Why, guys? Ebuka Hero. Good evening. My question tonight, like how many drips can somebody take? Because I took 6 for 2 days and it's disturbing my heart. Please address this issue. Ebuka Hero, who give you drip? Why then give you drip? My brother, this your question. The answer can never be gotten on social media. Who give you drip? Why you take 6 drip? What did they do you? Now doctor give you, I been for house, you take her. Okay, so Dr. Israel is in the house, and I'm going to bring Dr. Israel up so that he will continue to answer our question. So for those who just they watch us for the first time, let me bring up my co-host. Dr. Israel, your camera is not on. Talk to me. What happened? Quickly, so that make I tell them before I bring you up. Hey, Buka Hero, how far? What is inflammation? What are the solutions to inflammation? You're asking me you're asking me a pathology question. This question is beyond you. Inflammation is not a sickness. I see a lot of people, if they want to chop you on the internet, they will tell you say you get inflammation. Inflammation is what happens to everybody. And it means there's an abnormality, whether na trauma, whether na infection, whether na uh, extreme temperature. Everything will go give your body problem. Na inflammation. And they use pidgin English to break them down for you. That is not how we explain it. And you get different signs and symptoms. Pain, fever, that is pain, temperature, that place go swell up. The place go hot. You might not be able to use it. These are the signs of inflammation. You cannot treat inflammation because inflammation is not sickness. Inflammation is the sign pointing to sickness. Okay, Dr. Israel. Dr. Israel, how far? Good evening, Ibrahim. I see you. Dr. Israel, how are you? Dr. Israel. Okay, he's not here. Okay, I've answered this question. Please, let's take this question. Can family planning injection cause hormonal imbalance? It's possible. It's possible. It's possible. How do you regulate what? Let's see. Please, how can one manage fibroid and pregnancy? Oluchi, many women get fibroid. They don't born pikin. They fine. Some other women get fibroid. The fibroid give them small problem. Some other women get fibroid and they get belle. When they get belle, they go they monitor them, they check them together. So if you get fibroid and you are pregnant, you should not panic because you need to know the size of the fibroid, where the fibroid day, and many other things. They will help you manage them. You cannot manage it by yourself. I cannot lie you. Number two, the management of fibroid. Sometimes they go they watch you. Sometimes they will give you pain medication if you get belle and fibroid day. Do they help you manage them small like that? There are many ways that they manage them. So depending on many factors. So no go drink any concoction. No go drink any tea, any herbal tea, or anything with them mix. Say you get fibroid, make it help you melt your fibroid. They go scatter your body. They will affect your picking for belle. They will affect your fibroid. I'm saying it on this platform. No go drink any rubbish. They go spoil your body. They go spoil your belle for you. No go follow them. Speak with a healthcare professional. They go monitor you small. Okay, Dr. Israel is here. Dr. Israel, how far? How you there? Hello. Oh, I know they hear you. Oh my God. Okay. Doctor, my fasting blood sugar is 125. Please tell if it's okay or not. It is elevated. Your fasting blood sugar is elevated. It's above the normal range. It is above the normal range. Okay, let's see. Dr. Israel, I can't hear you. What is the normal kidney range function of an adult? Your question is non-specific. Your question will get ahead. you no get tail. Because kidney function get plenty parameters. Your kidney function test get plenty parameters inside. Your sodium, your potassium, your chlorides, eh? Urea, creatinine, and the rest. Are you asking me all those things on social media? No. You're not asking me medical class, because if I start to talk that one now, everybody go run leave me and you for here. So if you get kidney issue or you want check your kidney, I don't do video for you. I list the tests. When you do the test, your doctor go check the results for you. Go check whether it is normal. You go look up. You go look up. You cannot interpret kidney function test on your own. Hmm? You know fit, because those things wey dey there, dem plenty, and we go check them one after the other, one after the other. You go also do a urinalysis. Urinalysis go tell us whether protein dey, you have glucose in your urine, you have many things. Yeah. Okay. Let's see. Una question plenty today, oh, and the funny thing is that una no dey share this live session. I have back pain. What is the problem? Maybe your back pain now because of the kind of work wey you do, or maybe na your age, or maybe you go carry something wey dey very heavy. You get some people, the kind of work wey they do, they sit down for too long. If you give them back pain, some other people, age, they don't dey old, don't they get arthritis for their bone, or your spine, the bones for your spine, that your backbone, they don't dey press. So many things can actually give you back pain, or you dey sleep for bed, wey no dey help you arrange yourself. Now, because I get new people here, we don't do video on back pain. Me and Dr. Israel, we don't explain plenty things. We even put picture. So try, go YouTube, you will see the video on back pain. Plenty things they there we talk, and we give few tips to help you. Let's see. Una questions plenty, oh Jesus Christ. Thank you. This question, Mr. Shina, this question is a question that should be handled at the hospital immediately. What could be the cause of weakness and difficulty in breathing sometimes? This is your question. Now, question will be say you need to see a doctor immediately. So let me break your question down quickly. Weakness. If you no chop, you feel weak. If you waiting again, if you get problem with blood sugar, you feel they weak. If you get problem with your blood level, you feel they weak. If you get hormonal problem, you feel they weak. If you get infective process, some kind of infections, you feel they weak. Some people feel get early stage of cancer, they feel still they weak. Some other people feel get malnutrition, they feel still they weak. What am I trying to make you understand is that weakness get plenty causes. Therefore, we know if we confidently tell you, what be your name, Mr. Shina, say the reason why you they feel weak, oh, now this thing cause am. You know why? I don't know you. I don't know your age. I don't know when it starts. I don't know many things. You understand? But I'm giving you a general answer. Now, difficulty with breathing, don't be waiting with the take play. Sometimes your body feel they give you small signs. But our people go they look am until it don't come worse. It go come, it go go, it go come, it go go. You go use and play until one day you go come, you no go one come go. You go come they shout emergency. So rather than waiting, make this thing enter emergency. Carry your body, see doctor. Make your doctor check you. Good. Dr. Israel is in the house. So make I bring her up, make he answer, because una question they turn my eye. Dr. Israel, how far? How you dey? Oh my God. I know they hear you. God. Okay. Let's see. And then finally for you, Mr. Shino, this your weakness and difficulty in breathing, they might be the same. They might be, make I send Dr. Israel message. They might be from the same course. So see a doctor quick. I beg. Good evening. Please, what is the cause of smelly urine after urinating? And it will have one kind of odor. Most times, though, if person urine they smell, most times it fits the infection. If person urine they smell, most times. So making it be like this, and I'm not go answer you. I go tell you. Most times when you get smelly urine, it fits the say na infection they cause them. The infection wey they cause them, I don't know until your doctor prescribe test for you. Where you go come do, they will come see the results, they will come know. Other things dey too where they go check for your body, wetin be your lifestyle, wetin be your sexual life, wetin be your hygiene, many things to help us. But most times, if person gets smelly urine, it fit be infection. I beg, for those who they watch me for the first time, I beg, I know they give my number on social media. I know they do private chat with anybody on the internet. You know why? I don't see shaggy tire. I don't suffer on top this matter. So I get boundaries. I know they give my number, make anybody call me. I know go follow you do private chats. So anywhere you do, you get problem, see your doctor. If you say you won't follow me talk privately, you go book for consultation and you go pay. When you come pay, I'll come make out time to follow you talk. No vex. I respect my time and my privacy. But here, I will try answer you. Okay. So we have a question here. It says, good evening. Please, what is intermediate fasting and what are the benefits? Okay, lovely. Make I answer you. Intermediate fasting or intermittent fasting, now something where people do research on top. Okay, mostly for people who won't try to lose weight. They try. We know if you fast. Fasting no go help me lose weight. So intermittent fasting now say you go give your body occasional break from food. If you dey chop morning, afternoon, evening, intermittent fasting talk say you might eat once in a day, or morning and night, or afternoon and night. You go dey do and go dey give your body break intermittently fast, so that it will help your body break down. The only challenge with intermittent fasting is say a lot of people wey start am, they know they fit do am for long, because after a while they go tell you say abeg I don tire. That is one challenge about intermittent fasting. But if you can do it, it get benefits. It can help you manage your weight, most especially. It can help you feel good about yourself, because sometimes your body, you don't do chop. It will help your body too as a form of detoxification. It will help your body fit break down unnecessary substances inside your body and comot them. It will give your body break from food, make your body fit clean up itself and other things. Una no dey give me star for this live session, whether na Facebook or YouTube. Una no dey send me star. Ha! Osalobua. These people, una no dey share the live question and the live session. How do I measure my height? Go to where they measure height now. They will use tape measure or meter rule measure your height for you. You can't measure your height. So just go anywhere they get tape measure. They go just, you go stand, they go put them for you, check your height, calculate them for you. It's not a big deal. Okay, good evening, Beauty. Okay, somebody gave you 6 drip after buffing, after buffing, itching might be typhoid, because it used to happen to me whenever I have typhoid. Or you listen to me and listen to me carefully. When you take your baths and your body scratch you, no be typhoid. You dey hear me so? When you take your baths and your body dey scratch you, no be typhoid. We dey call them aquagenic pruritus. That is not typhoid. I use God name beg you. Delete some for your brain. Throw away that information within your head. Your information is very false. That is not typhoid. So if you take your bath and your body itch you, it is not typhoid. If you want to know more about it, I beg, go YouTube. There is a video about it, about itching after taking your bath. If you want me to make a video about typhoid with marker and board, everybody, if I see 100 comments, make a video with board. I don't do video about typhoid before, but some people know they watch, so I will do it again. But that is not typhoid. Yeah, I beg, I beg. Okay, doctor, please, can anemia be cured? Yes, anemia can be managed. It can be treated. I don't make video about anemia, low blood, but I never post them. I never edit them. Huh? Because anemia get many things where they cause them. Plenty things they cause anemia, low blood. So let me give you an expo before I post the video. They go tell you, say, malt and milk. Say if you drink malt and milk, it will give you blood. Now lie, oh. Malt and milk no go give you blood, though. So if you know you are ready, just keep yourself prepared. This week I go try edit the video and post the video. But I beg. I want first of all say thank you to all of you where they post my videos. Thank you so much. When I post these other ones to, I beg, make una help me share them. That way, now you support me. So I will try to make a video. So anemia get many causes, plenty causes. Now only when you know what they cause your anemia, that is low blood, you go fit treat them. Jesus, when I question the top of my eye, like I'm honestly tired. Questions are much, and Dr. Israel is not joining because his network is malfunctioning. I'm watching from Thailand. Okay, please, since I arrived here, acne and pimples has been eating my face. Sorry. What can be the cause and what can I drink like drug to get rid of it? Please help. Okay, so I go answer one question and the other one I no go answer around. The first one where I no go answer, I no go give you medicine because I know they prescribe medicine on social media for anybody. I beg. Here no be hospital, and I'm not going to put my license at stake for anybody. I beg. So I don't give medicines on my page. I don't prescribe medicines. But if you talk, say your acne, now when you enter Thailand, environmental causes, now they cause them. So it's obvious that something there, the environment, where they make you develop pimples. The tip where I could give to you online be say, find out where you they stay, maybe the weather, maybe try to take more fluids, try to wash your face more, take fruits to help you. And then which other thing I will give you on social media that is free? I'm giving you free advice for medicine. So which other thing again? I don't even know your sex. I don't know whether you're a man or a woman, so it's difficult. I don't know whether you're on any medicines too, so it's difficult. What again will he do for you? What again will he do for you? Dr. Israel, your network is breaking. Your line is not clear. So, Elisha, joy. What else can we do for you? For your pimples and acne on your face? Wash your face repeatedly. Wash your face. So, the final advice, if you know that you are not on any medication, you don't have any other symptom, they gain weight excessively, they sweat excessively, get excessive hair for your body, then wash your face. But if you get all that symptom, you might definitely need to speak with a dermatologist. Okay. God, I beg. These questions are massive. Dr. Israel, how far? How you day?
I'm fine. Happy Easter.
Thank God you can hear me. Happy Easter. So let's not waste time. The questions here are massive today. We have a lot of people on the platform tonight. So maybe try and respond to them sharp. This person says, Doctor, I had a tear during childbirth. The nurses said it will heal, but it did not heal. And when I complained, the doctor said the surface of the wound is healed already and cannot be stitched. But the tear is almost to my anus and I catch infection and I catch infection easily, what do I do? Ah,
Okay. Firstly, make I first apologize for coming late, and my network also be firstly they give me a little problem. So that's comp join the time when I can't take come late someone are not verse. Now for this lady, the nurse we first day in terms of your delivery. Now the nurse your first do that first do the wrong thing. So as far you get here from that beginning, they're supposed to teach you, and with that station the station go heal and that place go dey very fine. So for that woman not to for that nurse not to have stitched you, so it don cause its own problem. I think now you will need to see a gynecologist. So when you see a gynecologist, they may want to do a surgery for you to see how to fit take make that place cover, so that reduce the rate of infection when you go they get. So it depends on what the kind of tear when the doctor see. So the kind of tear go actually make them know what kind of surgery you do. But there's every tendency say they may want to do surgery for you to cover that and that tear. As I earlier said, I don't know how the tear be. I don't know whether the tear deep well or whether it dey very small. But just know say there's every tendency say they fit do surgery for you to make sure say that place close well, because those infection when you dey get fit lead to other things, fit lead to many problem where you not go expect. So see a gynecologist, not be
mm,
any doctor, not be just private doctor, not be your private doctor where you dey see for that, not your family physician where you dey see for every other thing. This one you go see doctor gynecologist where they specialize for woman body. So now then you go see.
yes.
Now they know what they go fit do for you to make sure say that place close and make you know they get those infection repeatedly again.
Yeah, yeah. Thank you, Dr. Israel. So, if you just dey watch this program for the first time, this program now every Sunday by 8 p.m. We don't dey do them every Sunday for 4 years now. For 4 years, me and Dr. Israel. So, if not your first time here, you dey welcome. Thank you for joining us. Now, let me take this one. Please, can you explain what is Helicobacter and the causes? Please go to my page. I posted a video 3 days ago about Helicobacter. I beg, watch them. Because if you know they watch those videos, it means say wetin we dey do no dey make sense. So try watch the video on Helicobacter. I mentioned Helicobacter, I mentioned wetin e dey cause for body and other things. Is the diabetic medication Ozempic safe to take during pregnancy? Also, is it safe to take to lose weight? Okay, let me respond to this one. Maureen, Ozempic is not a medication to lose weight. Ozempic na a medication where we dey give people wey get diabetes, we get obesity and other conditions. One of the benefits is say e go help the person as well lose weight. But guess what? Recent publications are also showing that Ozempic gets some kind of side effects. So I would not advise you to touch Ozempic if you get belle. Don't try it. Take only the medicine where your doctor prescribe for you. I beg. No touch Ozempic. Even if somebody tell you may drink am online, no touch am. Is it safe to take to lose weight? Unless you get other things attached to weight gain, what we call metabolic syndrome. That is, you get hyperlipidemia, you get maybe diabetes and other things. Then we fit tell you say may you take am. But if now just you get overweight or you dey obese, I beg, no touch am unless your doctor advise you to take am. I beg. Okay. Dr. Israel, somebody says I'm pregnant 6 months. Your baby never move. Why? Ah, Dr. Israel, I beg respond.
Another thing is that, is this your first pregnancy? Because if not first pregnancy, some women don't even know their belly they move if they are pregnant. That's one thing. So and two, you they go antenatal. If you know they go antenatal, you are wrong. So you need to go start antenatal. Three, you don't do scan for the pregnancy. You don't even do pregnancy test to even know if not really pregnancy or na another thing. So these are not things where you need to answer. And the best way you will give this answer to, not I don't think I'm the one. is to say gynecologist, obstetrician, that's those when they take care of pregnancy. Then they go fit find out why your baby not they move. Eh? Because
Mm,
the first thing when I talk, I said if you be first timer, you may not even know how baby take they move. That one and another, that one and one thing. For first time I learned 20 weeks now baby take they move. Well, 20 weeks. That is approximately 5 months. Shit, 5 months. Yes. So
yeah.
why for
Yeah,
old
about, yeah.
time around that kind 16 to 18 weeks, 20 to 22, 16 to
Yeah.
18 weeks. Now it take they move. Um. So you need to see a gynecologist first. If you never do test to even know whether you are pregnant, you need to go do test. If you know they go antenatal, you are not doing the right thing. So go start antenatal. And if you don't feel the hear the baby they move and you can't notice say you know they move where, I beg run go see your doctor for antenatal. Run go see him. Maybe you report to and say see what I they notice so that they go fit follow you up
Mm.
immediately. It's very, very important. In fact, that one an emergency.
Yes, so me then check you quick. Questions are plenty. Let's take this one, Dr. Israel. Good evening, please. More explanation on hepatitis, and is it curable, and what drug is best, please?
Okay, there are different type of hepatitis. There's hepatitis A, B, C, D, E, and so. So A A is fecal oral. So from dirty environment, you can really get hepatitis A. But I know say when people they talk hepatitis, then they talk about hepatitis B and hepatitis B mainly and hepatitis C. Yes, hepatitis B get drugs. Yes, when they fit you still treat and curable. Yes, it can be curable, it can be cured, but it may take a longer time and it also depend on your immune system. So I not go fit tell you any drug when they use because you we not the prescribed drug for you. So you need to see doctors, gastroenterologists, those doctors where they in charge of everything we concern the liver, the stomach, and now then you go see to actually know what and what to do for you. And another thing when I go advise, so if you never test yourself for hepatitis, mostly hepatitis B, I beg go test yourself. And if you test yourself, say you be negative, it's very good. You go take the vaccine, and when you take the vaccine, you'll be free from hepatitis B. Then you're not going to fear of how you go fit take get hepatitis B because the way to get hepatitis B through sex, through transfusion, and so on and so forth. So you can actually get it through those means. Even mother to child, you can also get it. Just almost the same thing like the way where you fit take get
Yeah.
HIV. But once you don't do the test and you see say you did negative for hepatitis B, you can actually take the vaccine and you'll be safe and protected from having the disease. So, however, if you don't already get the
Yep, yep,
disease,
yep.
it's time for you to go and see your doctor. May they find out is this disease is it acute or is it chronic? Is it causing any problem or is just there doing nothing? If it's just there doing nothing, you don't need to fear. Now just to they go for monitoring. But if it don't cause problem, then they will give you some medication to take help you, eh? So that you they fine. Okay, Dr. Fred.
Yes, so thank you, Dr. Israel. The questions are plenty, and we are almost out of time. Okay, we have a question here. If someone did an implant in her hand and it's expired, and she's afraid to remove it, does it have effects? Please, Dr. Israel, I beg.
Something will don't expire. Why you want leave am? Anything will don't expire is no longer part of. It's not having any function. Need to be removed. So if it's not having any function, it means that it can actually cause a problem to you. So yes, it may have an effect on your body, even to that hand that is there. And sometimes you feel even to say, see, they protect you before you know you don't collect one. 9 months don't complete again. So to be on the safer side, it is better you remove it so that you can, if you want to go on another one, you can actually go on it again. Make it for free, protect yourself, and also save yourself from any side effect when fee happen. So yes, it can actually it don't expire. You they take expired drug? No. So if you know they take expired drugs, so why will you leave what has expired for in your body? You need to remove it now so that you not go get any problem when
Hmm.
you go follow their come. Yeah.
Yep, yep. Thank you. We are almost out of time. Somebody says, what is the cause if somebody sees her period twice in a month? Oh God. Okay, should I beg
Okay.
answer?
Now, there are different ways to see period twice in a month. For some people, it's normal, while some people, it can be a problem. If you see your period maybe in the beginning of the month and you can't see end of the month, that not be problem because some people get a cycle of 28 days, 25 days. If you get cycle of 25 days or 28 days, there's every tendency say you feel see am two times in a month. But when you get a very short cycle, when you be say you dey see am, you see am now within before the next 2 weeks, that's like 15 days, you don't see them again. That one fit come a problem. But that other time when you see am, if they come out like normal or e just drop small small, because if you just drop small small, that may not be measles, that fit be another thing entirely. So when you don't dey experience things like that, it good make you go see your doctor, make dem for examine you, do some investigation for you, and after they don't do the investigation, if not to give you medication, they go give you. If not to tell you to change your lifestyle, they go tell you, and you go know what and what to do. So if you dey get anything like that, please go and see your gynecologist, doctors when they specialize for women body, so that they go fit tell you what and what to do, so that it can stop. But if you notice, say yes, it dey reach like 28 days, or 25 days, you don't need to worry yourself. Just relax, eat good food, drink good water, take folic acid and relax. Nothing go do you. Dr. Fred, you mute your mic.
Yes, yes. Sorry, Joe. Please, how true is this statement by most doctors? Oh, yeah, now that when you start taking blood pressure medications for hypertension, you don't stop it. You have to take it for life. Dr. Israel, let's respond.
Okay, BP medication is taken for life. However, sometimes it can be regulated. And when we say regulated, it can be regulated based on your blood pressure. If you don't dey take am and your blood pressure is well controlled, your doctor can actually tell you say, okay, they take am, go either reduce the dose of the BP medication when you dey take, or reduce the number of tablets when you dey take. Like if you dey take two or three, you can remove two, say make you dey take only one. Then even that one when you dey take, if you reduce the dose to the lowest dose. And sometimes if you tell you say, okay, no, they take am every day, they take am alternate day. All na based on wetin dem dey see for your body. Now for some person, dem fit even tell you say stop am for a while, then and but they check, they monitor the BP. So for anybody wey don start to dey take BP medication and your doctor come tell you stop am, e no just tell you stop am, e only tell you stop am for the while, continue to dey check your BP, because once your blood pressure don high, even though it's controlled for some time, most of the time e go continue to dey high, except maybe wetin whatever cause that blood pressure have been taken care of. If e be say na something na make that blood pressure high, like for pregnancy wey be say we dey call pregnancy induced hypertension. Some women wey be say once they get belle, their BP go high. Now that only in that kind of case, now once they don't born, most of them their BP go come down. In that kind of case, they don't need to take blood pressure medicine again, because they know say na pregnancy na cause that one. So in a case when we say they know what it cause and they don't treat that thing, they fit monitor your blood pressure for a while and tell you to stop it. That one now when they know what it cause and they don't address that thing. But in most cases, the causes of BP is not known. It's unknown. We only get risk factors. So because of that, once you start the blood pressure medicine, you almost likely going to take it for life. But just that your doctor go dey regulate am for you. Go regulate am to tell you which one you go take and which one you not go take, how you go take am and how you not go take am. And e go still advise you to dey monitor the blood pressure every time. So because when you dey monitor your blood pressure every time, you'll be able to know when to take medication and when to not to take medication. Now, You get the time when the doctor tells you, okay, never take your never. That is for people who never start BP medicine at all. You get the time when we say the doctor fit tell you, okay, now take, never start, just go relax. It not me say because they know say once you start, you don't start for life. Oh. It's just because they know say based on the questions when they ask you, they believe say they're not sure say you get BP, or they believe say if you do one or two other things, that your BP fit come down. Now make them tell you immediately say may you not start. But again, where the BP go be, whether you do any other things, they must tell you to start medication, or they fit even admit you. And once you have started, you have started. They go only feel regulator for you.
Hmm.
They may not stop it.
Okay, thank you, Dr. Israel. Our time is almost up. Sorry, this program na 8 p.m. to 9 p.m. Every Sunday. Today na question and answer. Now make we dey take questions. Some other days na other topic. We have a question here, Dr. Israel. Quickly, does hepatitis B have a cure?
Okay, I thought we said this thing before. Yes, it can be treated. It can be treated. Yes, they have medication that will take and you can get cure, but you have to take it for a very long. You have to take it for a longer time. And some persons self after they even take the medication, in some cases they may be they feel relapse, they feel get them again. But as at that time when they test this thing, they check the viral load, they want find that does this hepatitis B does it have any effect on this person, or can it be transmitted from one person to another, or if it's just there doing nothing. So they go always want to check that one for you as well. But the best is to go and get the vaccine. That's the best.
Okay,
If you are
so may
negative.
I add quickly to that? Some people, not be everybody will come in contact with the virus will get infected. You understand? And no be say when you test yourself, you can't they cry. So when you notice that you are positive, please speak with your doctor, so that may them follow you up. They go repeat tests for you, they go do viral load and other things for you. Very, very important. Let's go quickly because of time. Let's see. Okay, sir, what causes sudden death to those with sickle cell?
You already talk and they are sickle cell, so anything can happen to them at any time. If they are not well managed, so they are sickle cell patients. So anything can happen. So anything can cause it as far because they are sickle cell.
Okay. This question, since I started drinking early morning water, I have been adding weight. I'm surprised though, Stella, because water no get calorie, water no they cause weight gain. Maybe now psychological or now something else where they do, they make you gain weight. Water no they make people gain weight. I don't know if Dr. Israel get anything to talk about that one quickly because of time.
Nothing. Water now they give weight. So if you are having weight, check other things when you they do.
Okay, few more questions and then we are done for today. Let's see. Which question be this? Or which questions we have here? So many questions. I they scroll down. Let's see. Um, okay. I'm scrolling down. Let's see. Dr. Israel, let's see which question we get. Okay, let's talk about this one. Last one. I beg, waiting the cause waist pain.
Okay. For waist pain, many things fit cause, and you can see because based on the person where you be, your gender, whether you be man or you be woman. But relatively, your work when you dey do fit give you waist pain. If you dey sit down too much, if you dey stand too much, actually contribute to waist pain. The kind of bed where you dey lie down. If now the bed when you say once you lie down for the bed, it go choke you go inside. It can actually cause it can cause waist pain. For women, childbirth, if they do CS for them, maybe they give them injection for that back. It can cause waist pain, or even vaginal delivery. All those can when they give them any injection, they can have waist pain. Now for men, when they don't they old, uh, they physically get waist pain mostly when problem don't they happen to their prostate, lead to cancer, come metastasize enter the bone. They can have waist pain. Yeah, for women or men, infection can also cause waist pain and lower abdominal pain as well. So there are so many things when it cause waist pain. So you try and know what will be the cause of your own. Whether na the kind of work when they do. Majority of it na just the kind of work when we they do. Mostly for those of us when they Nigeria, the kind of work we they do, the kind of heavy load when we they carry, the kind of chair when you they sit down, and even how you they sit down for your chair still cause still cause waist pain. So
Yeah. Thank you so much, Dr. Israel. Any final words as we round up tonight?
I want to play it small. If we still have some questions, can we still take some maybe for just like another 5 minutes, just to dash them 5 minutes for us as sister gift?
Okay. Okay. So we have an appeal from Dr. Israel. So let's take questions. Let me go up quickly because of time. Is water allowed in fasting sugar test, fasting blood sugar?
Okay. Remember we say it is good to do your fasting blood sugar at least by 8 a.m. 8 a.m. Maybe you stop your meal, your last meal by 8 p.m. Your fasting blood sugar it should be by 8 a.m. But you remember say sometimes before 8 a.m. you don't brush. And when you they brush, you they use water they brush. And sometimes even when you they brush and you they use water they brush, sometimes you they mistakenly swallow some water. I will still not complain about that. Reason because water not contain calories. Water not get calories. So it cannot alter your blood sugar test.
Okay, we have a question here. It says, "Good evening. Please, how can you treat private part and body itching?"
Okay, if you dey think about treatment, please go and see your doctor. He will be the best person to answer that question. And try and see your doctor. If you're a lady, it will be good to see a gynecologist.
Okay, let's see. Okay, we have a question here. It says, "Good evening. I'm 38 years old and I easily get muscle tear and hamstring injury during football match. What can I do to help?"
Okay, if you dey always get hamstring and muscle tear, most of the time there are some kind of things you need to put on, and mostly your you need to wear to reduce the stretching of your muscles and the stretching of your muscles and all that. So I think you also need to talk to your sports doctors. I think there are some doctors attached to you guys in terms of sports, occupational doctors, so that they will actually tell you what to wear, so that will help to protect your muscle from over contracting and overworking. Then that will also reduce your muscle tear and all that. And also you need to also reduce, in a way, if you dey do too many exercise, you need to cut it down to some extent so that make e not go get a lot of effect on you in future.
Okay. Because of time, we have a question here. It says, "Why is diastolic why is my diastolic pressure and pulse high even though I am taking a blood pressure medication?"
Now, when you say your diastolic blood pressure is high, what is the value for you to say it's high? And also, there are some medication when we say that they take care of one part of the blood pressure, that they leave the other part. That is, they fit take care of the systolic and leave the diastolic. Now, it now depends, and sometimes we they talk so many things when you come to hospital. You get diastolic hypertension, systolic hypertension, and all that. And there are medications that can actually correct these different type of hypertension. So it now depends on the kind of medication you are taking and the kind of hypertension that you have. So when they really know, when they are able to classify it for you, they'll be able to give you the best medication that will correct it, and then you'll be fine. So not to stress yourself, not worry yourself, and not to fear, because too many things will not really happen to you.
Okay, so Israel, you don't reach 5 minutes, so
Okay.
Okay, so ladies and gentlemen, no vex. Our time is up. Dr. Israel Simo will give you 5 minutes more, and we don't give 5 minutes more. This program now every Sunday, 8 a.m., 8 p.m. to 9 p.m., 1 hour. And we dey do am. So if you come late, no vex. We know they won't waste time online. Dr. Israel, any final words?
Okay, first, I want to apologize again for coming late. I had some little activities that I went for before I can join. So that now one then my network council decide to do your village thing join Dana too. But the good thing is I'm happy to say we fit answer some of our questions. For those who will not fit answer on our question, on our verse, maybe at some other time, just to keep the question, you may be able to answer it. Or if you mistakenly see us online, live on live, you can actually bring those questions and it will be answered. Those name Dr. Fred and the quick live. And I want to say for those of us within Nigeria, even the world in general, we could try to take care of our mental health. I dey always talk this thing. We will try to take care of our mental health. It's very, very important. Don't allow anybody make you vex. Eh? Happiness now inside your body e dey, e no dey from another person. Now you go only fit make yourself happy. So in everything wey you see around you, try and make yourself happy. So that make you not go
Mm.
give person slap when you not supposed give the person slap, or make you not go dey cry when you not supposed cry. Yes, many people are depressed in this country when we never even know. So if you get relative around you or even relatives that are far from you, try call them, try ask of them, try to find out how they are. Just a simple how are you today may go a long way to heal those people broken hearts. So make we try to take care of ourselves and also extend that care to our relatives, to our friends, to our loved ones, so that everybody eh, go, their mental health go dey in a good shape. Thank you.
Yeah, thank you, Dr. Israel. Before I round up, Pretty Bella, I want to say thank you to you, Pretty Bella. You send stars for this live session. Now only you send me star for this live session today. Thank you very, very much. I did grateful. And also, Dr. Israel, thank you. Thank you for watching. I beg, not forget, we dey try to ensure say we give you information. If you get any problem, please speak with your doctor. No, they look for medicine on the internet. You know they safe. The internet is not safe. Collect information, no problem. But if you get problem for your body, I beg you. Biko, jaw, don't want la. Whoa, whoa, s'il vous plaît. See your doctor. Make them check you. This idea where we dey buy medicine on the internet, plenty people for social media where they sell medicines, and majority of them, I don't want to say all of them, majority of them now to chop you and run away. So be careful the medicines where they buy on the internet. If you want to join my private telegram, like I always say it, if you want to subscribe and join, look for the link, subscribe, join. When you come in there, you go gain more benefits, more value. I go always tell you, good life now waiting. Oh yeah, good
Nonsense.
life, good life, good life. Nonsense. Thank you, everybody. Take care and have a wonderful day. Bye bye.